the most Cohen people. I think I've shared, so for those that don't, well, most people don't know, my husband has really bad osteo. And I'm just wondering if any of your patients, because I feel like, because he's got some of the Cohen symptoms clinically, physically, like the absorption issues, because he's pretty young. I mean, he's had it for a long time. Have you noticed anything in your patients like just out of your clinic, Dr. Wang?
Yeah, we did some small scale research on Cohen syndrome. We actually, for that particular research, we bought the bone scanner, like bone density, and just for this study, we actually, I think that at least one time during the conference, we did all the children who come during that conference on the bone density. Overall, it is low. I think the only, if I recall, only two individuals with Cohen, they have no more density, bone density. For our other children, they're low. That actually we also go back to find out about the vitamin level. I think the one of the reason we attribute this low bone density is low vitamin D level. So in general, as our practice, we recommend all the parents, make sure give vitamin D supplements, enough calcium. So we don't know if this is a part of disease. It can be corrected by vitamin D, or this is or cannot, but we don't know for sure. But in general, just like you point out, it's actually the bone density is low in general, even without a GCF. We feel it's not related to the GCSF injection, because a lot of patients with low bone density in Cohen, they didn't have the injection, they didn't receive the injection. Yeah.
Yeah, well, I was just curious if anything since. I know I talked to you about that a couple of years ago, because my husband has really bad bones and he was very fit before. So I kind of feel it's connected. So I just figured I'd ask. So
Dr. Wang, is there a blood panel test, like a list that you have maybe that we don't have our kids, or our kids' doctors don't run on a regular basis, that you might think that we should ask our doctors to run on our children?
We regularly check we can provide it, we can email on that. Yeah, we regularly check the CBC, just trying to check the neutrophil count. And then we check the SAD rates. That's inflammation index, trying to see, if there any concern. And vitamin D is something we also regularly check for our Cohen syndrome patients. To just add what we follow up this great presentation Dr. Michinsky just give to us. A couple other things I want to add that is actually one is some children, they have normal neutrophil when they are in the hospital, because a lot of times they came to the hospital with the infection. The normal body reaction to the infection is increased neutrophil. That's our normal defense mechanism. So when the children end up in the emergency room, Cohen syndrome children, they have normal neutrophil. A lot of time, I would recommend to check when they're well, when they're healthy. And then that is illness they presented, the mechanism come to the emergency room could mask their neutropenia. So that's one thing maybe we can potentially remember for the children when we move forward. The second one is, just like Dr. Michinsky say, the multiple effect could actually cause the neutropenia, and then the children with the Cohen syndrome, they are more vulnerable with the neutropenia. So we have to be careful with medication use. Just like the table, he just showed there is a certain medication can decrease neutrophil. And then since they are vulnerable, the baseline is already low. Then if they're taking some medication, every day, sometimes can make the neutrophil lower, and then make them, a much more dangerous level. I personally do have experiments with this. Those children, they tend to have a lot of infection. They use antibiotics. Cephalosporin is one actually, we use, but we have to be careful. Use so many times, so long, then it itself can cause neutropenia.
And then what about treating fever? I think we've always been in the camp of don't treat fever unless we know an ANC count prior to that.
We treat fever because we know those children already. So we do treat fever for sure, with any hesitation. But we do need to keep in mind the fever in colon can be more dangerous, than normal children because they have low white cell count. They can become much sicker because they have neutropenia.
Yeah, because I know Morgan, like where she doesn't have to take the injections. And, I went to the doc, took her for the ELA gene and all that checking, Beth. And I know for her, like I've treated fevers, but I know that there's kids that have take the injections and stuff where it's a different story. It's probably checking with your doctors, I guess, on what the best practice is, depending on your children's clinical.
Yeah.
Do you think anybody have any questions for Dr. Wang?
Don't see any popping up. Any board members, any panelists?
I don't see it. I wonder, should we ask the families if they want to try to, no one has questions. I know Ashley needs a little time before she can come on.